Okay, today we're gonna go over coronal polishing. Remember, you're never gonna open your instrument pack until the patient is in the chair. Don't forget about your PPE, your gloves, mask, and your jacket. We're going to open our basic setup. The little tabs. We just dump out our instrument. Instead of having to get up, throw it away, I'm just gonna stick it under. We have our Explorer, mirror, our cotton pliers, and our air water syringe. We're going to put this in by pushing this back and then pushing that in and gently pushing. That's all there is to it. This is a hygiene hand piece. This piece here toggles so the hygienist doesn't have to switch their arms. As an assistant, we normally just polish for children, not on an adult patient usually. Sometimes we can help out accelerated hygiene if that's what your job is. This is a disposable Profi cup. This gets thrown away, and this is the only part that goes into the patient's mouth, not the hand piece. She's going to use grape today, and I'm going to attach our HVE and our saliva ejector right behind the camera woman. We're going to take this off, push this in nice and tight, and bend it a little. Go back on, and take the HVE, push it in with a little window up. I'm going to take this, since it's just me doing it, I'm just going to put it over here so when the patient needs it, I have it. Or I could let her hold it, but I might use it for some retraction. We are going to let her chew up a Disclosing Tablet. You're going to chew this up. Don't swallow. I have the suction right here, okay? Usually you'd be sitting up to do this, but since you're already there. This is for the Disclosing Tablet. A lot of times in school for the kids, they would chew these up or brush it on their teeth. The darker outlines on the gums, go ahead and chew this up, don't swallow. When you get a mouthful of saliva, let me know. The plaque will be outlined on the edges where it's darker and on the teeth where it's not as much. This will help us polish it all and clean the teeth properly. So keep going around, spit it all around. There you go, keep going, spit, 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 don't swallow. It won't hurt you if you swallow, but, and close your lips. And open. I'm just gonna go around and get all the extra pieces. Close your lips one more time. All right, good, now open for me. So for Megan's teeth here, open, we bite down. You can see she does a pretty good job. You can see in between the teeth down here. Open for me, Megan. She has a lingual retainer wire, so it might be kind of hard for her to get in there. We're gonna show her that today. And then around the edges, she does a pretty good job. So I'm going to take our paste and load up our Profi cup. I'm gonna set this right here. We can start on the upper right, the upper left. Really get your rhythm. You don't want this pedal to go too fast. It sprays this everywhere. If you get a lot of saliva on it, you'll want to wipe it off with the cotton. I'm going to start on the upper right. Excuse me, the upper left. So, and if there's not a lot of room back there, we can have her close down, bite down just a little bit, turn towards me. I'm going to retract. Can you see? So we're going to go from here. We're going to kind of scallop around the tooth, just a small little area, not too fast. You okay? Just like that. Go around the edges and kind of make the little cup flare out just enough to get that pink off. Ask our patient, how you doing? All right. Get a little more paste. And come around to the front. Kind of just scalloping the tooth, not rubbing on the gums. Don't want to hurt her. See how it kind of flies when you hit the button too hard? You don't want to stay on the tooth too long because you can heat up the nerve and make the tooth hot, and that could make the tooth need a root canal in the long run. Okay, you can turn toward the front. Good. I'm going to go right here on our front tooth and kind of flare down. Same thing right here. I have my finger on her chin as a fulcrum. So I don't take my fingers up her nose or anywhere like that. Nice little strokes. Need to rinse out? All right. Gonna keep going. Again, open for me. I'm gonna take my suction. And close your lips. There we go. Thank you. And come over here to the upper right and close just a little. When they close, they give us some more room. So if it doesn't have a lot of movement, you can make it some by just going up there. Again, we're just gonna go along the margins. Making a little cup flare out. Okay, open for me. I'm gonna go over this a little bit more right here. Try to get all that pink off for her. All right. Give you a little bit of a rinse out. We'll go to the lingual. So I'm gonna use this to retract her cheek. I'm gonna hold it and then rinse. Alright, go ahead and close your lip. And it's got her a little wet, it's okay. Now we'll go to the lingual. Tongue side kind of tickles a little bit. Let's start up here. See how that starts to just build up around it? Just wipe it off so it doesn't start to fly everywhere. You can take your mirror to make sure that you can see on the lingual side, so you make sure you're getting all the pink. Mirror starts to fall, just rub it on her cheek. Behind the front teeth, a little bit of tickles. And we're going to just keep going around. Doing okay? Always checking on our patient. You won't use this whole thing. Go around the lingual. And we'll do our occlusals just to get the pink out of there. And we'll give her a rinse, go to the bottom, and we're almost done. You're doing great. Three showers. Gentle humor. Close your lips. Okay. We'll go to the water. Get our cup full. And our mirror, and turn towards me. We'll go on the buckle. I'll move that out of the way. We can just go around the side. Angling it at the distal and the mesial just to get it everywhere and all angles. Okay. Canine. So it's just kind of like you are painting, kind of. You just want distal, facial, mesial of the tooth. Just to get all the sides, everything done. Okay. Retract back here, go to number 31. And we'll go to lingual. You doing okay? Mm-hmm. Close your lips. Good. Our last go round, rinse and floss, and you're done. Okay. The lingual. And here's where her lingual wire is. So we're gonna polish that too, just gently. Almost done, Megan. Turn this way. Sorry, got your cheek. Get the pink off. Give you a nice rinse. Rinse her out real good. Sorry, I'll try to make you jump. Trying to get all that grit out for you. Close your lips. All right. You still feel gritty? Not too bad? All right. Now we're gonna floss her. We're gonna take our floss, wrap it around our middle finger or your index finger. And I'm gonna start on her upper left. We're gonna take this between and make a C on each tooth. Okay? I'm gonna go all the way back. We're gonna make sure we get the distal of the last molar. Even though there's not a tooth behind it, you still wanna get that tooth. I have a little piece of cotton. We're gonna wipe this on. And we're gonna go between these two gently. Make a C and come back through. All that pink's coming out through the floss. Okay? Gently go in. Tight contacts. Go in. See here. See here. You okay? Make that C. Scrape the tooth. Get anything off of it. All the way in. Under the gums a little bit. Make that C. Shit. Gums. Nice pink gums. She's doing great. You don't want to push down too hard. Hurt the patient's gums. I keep switching my floss too to go to a different spot so I don't move any bacteria. Let me change my finger. And that last little back one. How you feeling? You okay?
Mm-hmm.
Oops. Never say whoops. Get tight muscle right there. Okay. Was it too bad?
No.
So we'll go to your lower. Your lower has that lingual retainer wire. I'm just gonna floss all the teeth around it and then do that last. Okay? Turn towards me just a little, or towards, there we go. Stand. Get the back of the molar. And scrape the tooth. Make a C. Okay. Go over here, get behind our little molar. See that skin attachment's where her wisdom tooth is back there. I can polish right there, get that some paint off. And we want to keep it clean under there so no infection gets under there, no bacteria or anything like that. You okay, Megan?
Uh-huh.
Okay. So now we're going to do that little retainer wire. So, this is a floss threader. This goes under retainer wires, bridges, anything like that. You could tie it on here, or you could just make a short little hoop here. So when we push it through, there's not much for it to go under there, and we can floss normal. So we're gonna take this, open for me. This tooth, it's from canine to canine. So 22 and 23, we're gonna go right through underneath the gums. A little pinchy, I know. Patients like to fight you too. See, her tongue wants to come up here and block me. Sorry, maybe, okay? Okay, here it comes. No, very pokey. You can grab it with your cotton pliers and gently pull it through. Now you have it under there. A little bleeding won't hurt anything. It's gonna make everything start to heal a little better. And we'll go on this side too, underneath. And pull it back out. The bleeding is from it if the gums are just irritated from the wire. It seems to not be friendly sometimes, but it's a great thing for ortho to keep her teeth from not moving. This is a lot easier. I'm gonna go this way, go through. I'm wiping the floss each time. Alright, there we go. Get none of that gum. Two more. You're doing awesome. And I'll give you a good rinse out. They're all done. Let's give her a good rinse out at this stage. Close it up, and there we go. You put this back over here. Bring the boxes up here. Push that out. Let's keep it away. And